Good morning, everybody. I am Dr. Larson Itaruk from the Department of Otorhinolaryngology, Head and Neck Surgery. I am tasked to discuss the common ear diseases. But before that, we have to review some important anatomy. The ear is divided into three parts. The external ear, which is composed of the pinna or the auricle, and the external auditory canal. The middle ear, which is bounded laterally by the tympanic membrane and medially by the promontory, and it houses the ossicles. The inner ear is composed of the cochlea and the three semicircular canals. The external ear. Again, the external ear is made up of auricle and external acoustic meatus. It is 2.5 centimeters in length. Lateral 1/3 is cartilaginous and medial 2/3 is bony. This is the pinna or the auricle and the external auditory canal with the tympanic membrane. We now proceed to the diseases of the external ear. Impacted cerumen. Cerumen impaction refers to the build-up of layers of earwax within the ear canal to the point of blocking the canal and putting pressure on the eardrum. It is often caused by misguided attempts to remove earwax. This is an example of an impacted cerumen completely obstructing the external auditory canal. The patient will complain of ear pain with decreased hearing with history of swimming. Otitis externa, which is also known as swimmer's ear, it has rapid onset of less than 48 hours of ear canal inflammation with severe otalgia worsened with manipulation of pinna. We call that as positive tag test sign with pruritus, edema, and ear discharge. The diagnosis of otitis externa is based mainly on history. The patient will complain of ear pain, ear discharge, with history of swimming, manual manipulation of the ear canal, and trauma. On physical examination, there is positive tag test, positive for tragal tenderness, and narrowing of the external auditory canal on otoscopy. The first line of treatment is prevention. You have to prevent or avoid water from entering the ear canal and avoid manual manipulation of the external auditory canal. The treatment of choice is topical antibiotics and oral toilet. Oral toilet means cleaning the ear canal and removing the debris. Malignant otitis externa is a progressive necrotizing otitis externa. It is an aggressive infection of the external auditory canal, mastoid, and skull base that can be life-threatening. Most patients are elderly and have diabetes. Pseudomonas aeruginosa is the most common organism involved. Signs and symptoms of malignant otitis externa are otorrhea, severe long-standing otalgia with neurologic deficits of cranial nerve 7 to 12. The pathognomonic sign of malignant otitis externa is the formation of granulation tissue at the isthmus of the external auditory canal. By the way, the isthmus of the external auditory canal is the narrowest portion of the external auditory canal. The treatment should be culture-directed and typically last for 6 weeks. Herpes zoster oticus. This is a varicella zoster virus infection of the auricle and the external auditory canal. Signs and symptoms include otalgia, vesicular eruption in the canal and the concha, tinnitus, and hearing loss. Patients may manifest what we call Ramsay-Hunt syndrome, wherein there is now otalgia, vesicular eruption that involves the pinna and the external auditory canal, and facial nerve paralysis. The treatment is topical antibiotics and steroids and antiherpetic agents such as acyclovir. Otomycosis is a fungal infection of the external auditory canal which is caused by Candida albicans, mucor, and dermatophytes that aggressively infect the skin if the milieu has been altered, which is seen in immunocompromised patients. Signs and symptoms include severe itching and feeling of fullness in the affected ear, as well as otalgia. The treatment is topical antifungals and oral toilet. This is an otoscopic exam of a patient showing a cottony white colony which is seen in otomycosis. Microtia is a congenital deformity of the auricle. Microtia deformities present in various shapes and sizes. They are divided into three broad categories, actually four. No? The type 1, it has mild deformity. Type 2, ears have major structures present to some degree. And type 3, there are few or no recognizable landmarks of the auricle. And type 4, or what we call anosia, there is complete absence of the auricle and lobule. The preauricular sinus is a common congenital malformation noted as a small dels, this one, adjacent to the external ear. It occurs as a result of incomplete fusion of the hilux of His. If you can recall in embryology, the auricle or pinna is made of 6 hilux of His. The treatment is surgical excision if infection is recurrent. Foreign bodies in the external auditory canal are very common. This is an example of a crystal, plastic crystal embedded in the external auditory canal. This is an eraser impacted in the external auditory canal with swollen ear canal. And this is a beads impacted in the external auditory canal, and an insect, which is a cockroach, entered in the external auditory canal. The patient will complain of severe pain or excruciating pain upon movement of the insect.